The materials found in this video can be located in Chapter 1 of the 11th edition of Human Anatomy and Physiology. In particular, I'll be addressing the question, what terms do we need to describe body cavities and membranes? So, first off, axial and appendicular. So you can see here in grayscale, we have axial. This includes the head, the neck, and the trunk. And in color, in blue and yellow, we have the appendicular portion of the body. This is the limbs, that includes the arms and the legs. So first off, we're just dividing up the body. Most of what we'll be looking at will be within this axial portion. So when we're talking about body cavities, a lot of that is within the trunk, but also within the head. There are lots of regional anatomical terms. Here are the big ones. So you've got cephalic, referring to the head. You can see that with the head, we have frontal is in the front, orbital is around the eyes, nasal, the nose, buccal, the cheeks, oral around the mouth, and mental stands for things that are around the chin. We have cervical, which is dealing with the neck, thoracic, which is the chest. That's actually highlighted here in orange. So the chest is right there, that's thoracic. Abdominal is a word that's used to refer to things surrounding the stomach. So your abdomen, it's shown here in purple. Pelvic has to do with the groin region, and pubic has to do with the genitals. So these are anatomical terms you can see at the front of the body. We can also look at the other side here. We have limbs, so there's an upper limb, which includes the shoulder and arm. Antebrachial stands for anything having to do with the forearm. Manus has to do with the hand. Lower limb includes the hip and the thigh. The patellar, anything patella or patellar, refers to the knee. And pedal refers to the foot. Now if we look on the posterior view, we see many of the same structures. However, this would be the posterior or dorsal view. So not mentioned on this slide, this is the anterior or ventral view of the body, whereas this is the posterior or dorsal view of the body. So those were all just regional anatomical terms. So regional meaning it's helping you to identify where in the body something is located. So if I mention to you that something is cervical, you should be able to figure out that that is around or related to the neck, for instance. Now we can start thinking about body planes. This is especially important when you're thinking about, say, dissections, or at some point maybe you're involved in surgeries of some sort. You want to have the names for different planes down. So we have three major planes we'll be thinking about this semester: sagittal, coronal, and transverse. So what I've done here is break this down. So the sagittal section, you can see, it's a little morbid, but let's just pretend this is a glass plate. And that glass plate has moved through this particular person in this direction. That cut is a sagittal cut. What this means is that on one side of the cut is the left side of the body, and on the other side of the cut is the right side of the body. So it's dividing left from right. Now it doesn't have to be on the midline. This is actually called mid-sagittal when it's along the midline. But it is going to divide left from right. That's a sagittal cut. A coronal cut, on the other hand, you can see here, it's as though this pane of glass has entered on the right side of the body and has protruded all the way out of the left side of the body. That means that on one side of this plane is the anterior of the body, the front of the body, and on the other side of this cut is the posterior. So with a coronal section, you're dividing front from back. whereas sagittal, you are dividing left from right. Now finally, we have transverse sections. In this case, you're dividing top from bottom. So you can see the pane of glass has cut this person in half. So her torso is now separated from her legs. That means that one side of the cut, or one side of the plane, is inferior, and the other side is superior. So those are the three body planes: sagittal, coronal, transverse. Especially if you're maybe doing some imaging or looking at the results of imaging, you're going to want to know what the body plane was. You'll probably eventually be able to just recognize that, but it's good to be able to know. Or if you're requesting imaging, you might want to be able to tell people, I'd like a sagittal view of this structure, or I would like a coronal view of this structure. So I've already sort of clued you into this, but when would it be useful to use these terms, sagittal, coronal, and transverse, in a healthcare setting? There are lots of right answers to this, including the one that I just gave one slide ago. So here's that one, and this is extending the figure from your book. What you can see here is a sagittal section of the body. The vertebral column moving down, we can see the sacrum here, the rectum, the intestines. If we have a coronal view of the body, now we can see a lot of the structures in the thorax and abdomen. And finally, if we have a transverse section through the abdomen, now again, we see a lot of these same structures, but we're featuring others. So now the pancreas is well featured, whereas in this particular section, it's not as well featured. So we can see different structures based on the plane that we choose to image from. So now we move into body cavities. There are two major divisions. So we have a dorsal body cavity, which is highlighted in yellow here, and a ventral body cavity highlighted in red. The dorsal cavity is including both the cranial and the vertebral cavities. So cranial, remember, refers to the brain and to the skull, and vertebral is referring to the spinal column, so the spinal cord. We also have in the ventral cavity these three large or smaller subdivisions. So the thoracic, this is containing the heart and the lungs. We have the abdominal cavity containing the digestive system mainly, and the pelvic cavity, which is containing the bladder as well as reproductive organs and the rectum. So we can take a look at this. So here we had a sagittal view. Now we're going to take a coronal view of this particular person. And now we can see those dorsal cavities, so cranial and vertebral cavities. We can see that the thoracic cavity is actually broken into smaller parts. So if we now see from this sagittal view, the thoracic cavity looked fairly simple. But from this coronal view, we can see that it's actually split. So the heart has its own pericardial cavity. The lungs have their own pleural cavities, so there's one on either side of the body, one for each lung. And then we also have this smaller cavity, the mediastinum, the superior mediastinum, sorry. If we move down, we can see the abdominal cavity, still pretty large, and the pelvic cavity below it. Sometimes you will see in your textbook, these are combined. And so you'll see that a lot actually in anatomy where words get glued together. And so in this case, we can call this collection of abdominal and pelvic cavities, we can call that the abdominopelvic cavity. And so now if we look in on that abdominopelvic cavity, we know we can divide it up into four major quadrants. So we have two upper quadrants, right and left upper quadrant, and two lower quadrants, right and left lower quadrants. Why would I care? Why would I care about thinking about this? And when, say, in a clinical setting, might it be important for you to understand these different quadrants? So let's say that a patient comes in and tells you, for instance, that they have discomfort in their right upper quadrant. Now, likely the person is just going to point, but hopefully you'll be able to recognize that that is the right upper quadrant. Based on what you can see in this image, what would you guess is going wrong? The two big things I see are most of the liver is in the right upper quadrant and this gallbladder. And it turns out most of the time when people experience pain in the right upper quadrant, it's gallbladder pain, so gallstones. How about the left upper quadrant? What might be happening there? Well, if I look here, what I'm seeing is actually the stomach is pretty visible in this particular picture. There's also a spleen hidden over here. And so maybe there's something going on with one of those structures in the left upper quadrant. The right lower quadrant, typically what's happening here is something to do with the appendix, actually. And finally, the left lower quadrant, in this case, it's maybe some intestinal issues. So that finishes off the questions, the learning objectives from Chapter 1 of your textbook.